Magandang araw po sa inyong lahat. Sunday, a very fine morning. Nandito tayo, maswerte tayo. Sa araw na to, we are graced with the presence of my patient. Ito, kakaibang patient to. Kasi, hindi naman sa may bias, but siyempre, every once in a while, we meet patients na yung masasabi natin na nakapag-aral, sabihin professional. And ito pong patient na i-introduce ko sa inyo this morning, siya yung ganong uri ng pasyente. So, very mild-mannered, very soft-spoken, sabi nga na lady. Kaya, I really have to adjust din sa kanya kasi ako yung personality. Parang magkaiba kami ng personality. But I really need to adjust to her. Natutunan ko na pag ang pasyente pala ay may yung ganun siya, yung mild siya, very soft-spoken. Mas malaki din yung chance talaga niya na gumaling, which is what happened to this patient. Kasi nga, yung personality niya po ngayon played a big role on how she manages the stress of being diagnosed with cancer. So, yung unique part ng aming interaction through the years since 2019, right? So, si Ma'am Eva, siya po ay case of cervical cancer. Sinabi sa kanya na stage 3 yun because of the parameters used by the gynecologic oncologist. She was diagnosed way back in September of 2019. Take note niyo po yung year na 2019. And then, right after diagnosis, she underwent surgery wherein it entailed the removal of the entire reproductive tract, or reproductive system, ng isang babae. It's called TABISO, or total abdominal hysterectomy with bilateral salpingo oophorectomy, which is the correct surgery sa kaso niya noong time na yun. And it was in that surgery that it was found out that it has already metastasized sa mga lymph nodes around the cervix. So, she was adjudged to have stage 3 then. And after which, she saw me the following year, February 2020, ito na, 2020. Nagkita po kami, and then upon discussion of her case, upon offering her yung program na ginagawa ko, which is the Immunotherapy program, she opted to undergo that program with me. Natapos niya po, started niya noong February 2020, natapos siya right before the lockdown in March was announced. So, nasakto naman, nakatapos siya lahat yung buong program. And then, for the next few months noon, every 3 months, every 6 months, nakikita kami, siyempre for monitoring of response. And with God's grace, ngayon, ito, mid of 2022 na, and the patient remains cancer-free. Okay, so I hope you will be inspired. Again, ito na naman, isa na namang kaso ng, isa na namang case which proves that cancer is not a death sentence. Basta ang patient ay lalaban, siya ay mag-decide kasi it's really on her, it's really on the patient talaga na mag-decide na cancer will not be beating her or him, sabi nga, para ma-survive niya itong disease na ito. At talaga naman siyang kaya naman. So without further ado, friends, I would now give the floor to my patient, si Miss Eva Custodio, so that she would herself be telling you her story, her entire journey. Diba? Ay, nga pala. Una-una, salamat kasi Sunday today, family day, di ba? Kasi chose to spare time, sabi nga sa amin. So this is a big favor na magawa mo, and definitely sa mga pasyente na iba na makakapanood ng video na ito. I know that the information that you will be sharing them, your story, would somehow inspire them to fight when they ever get cancer.
My pleasure daw. Hi, good morning everyone. Happy Sunday. My name is Eva Custodio, and I was about going to my 40s when I was diagnosed with cervical cancer. Preliminarily, I was diagnosed with stage 1B, and then it was then the decision of my series of surgeons to take the total hysterectomy. So I went to surgery November of 2019, and I thought after the surgery all will be cleared, since the doctor mentioned during the operation that all went well and there's no need for further medication. But right after a week of the diagnosis with the pathology that they have taken out with my body, I was been suggested to undergo a series of treatment, and that should be the chemotherapy and simultaneously with the radiation. So with the decision that I've had, and of course with the series of research that I do, and of course one of my closest friend, Mayra Marquez, able to suggest me to go over and look for Dr. Lunas. So that was Doc Cherry Isguera. So with that, masaya ako na nasabi ko sa sarili ko na I find this alternative na hindi ako mag-undergo ng chemotherapy, kasi personally ayoko talaga ng chemotherapy. Not that I learned some stories or whatsoever, but my body speak of ayoko talaga ng ganong klaseng treatment. So I went to doctor, and I'm happy that during our first meeting, he was able to convince me and convey the message of his alternative of gynecology treatment. So by then, I started my series of immunotherapy that was 16 sessions. So I finished that before the lockdown. So masabi nga nila parang it's a grace within the midst of crisis that I was able also to cope up and recuperate after that a series of treatment. So pupunta ako sa Klinika Manila, and then I go over to St. Luke's for the radiation simultaneously. And thank God, sa grace nga ni Lord at sa mga holistic procedure that I've gone or I've been with Dr. Isguera, I was able to manage, and I can tell that now I am cured with the so-called C, which is the cancer. So sabi ko dati, when I first heard from my doctor na mayroon akong cancer, and it's a mixed emotion, like but most likely parang sad ka kasi sabi mo parang mamamatay na ba ako, Doc? That's the usual question that I always ask to my doctors and whoever na parang closest ko in my heart na tatanungin. But here comes this doctor na nasabi na hindi na, gagaling ka. So you should just have to believe. Kung naniwala ka sa doctor mo na siya ang tutulong na para ka gumaling, much more na maniwala ka sa Diyos na siya yung tutulong sa'yo. Kasi everything happens for a reason. Siguro sabi ko noon, sometimes when I'm talking to Doc Jerry, sabi ko, Doc, siguro it's a way of reminding me ni Lord na parang nalimutan mo na rin ako kasi parang sobrang busy in life, busy sa career. But sometimes you need to look back and then prioritize what should be needed to be prioritized. So sa ngayon, I feel lucky that I know the doctor who can assist me, who can go along with what I have in my thoughts, kung ano man yung minsan yung mga doubts ko. When I see him and ask him for anything, parang uwi ka na masaya at uwi ka na parang kontento ka na at maniwala ka na tuloy ang buhay at ikaw ay gagaling. So I hope it's not just bragging everything for Doc Isguera, but it's a life testimony that I would like to also encourage everyone who is experiencing the same, na maniwala ka lang at ikaw ay gagaling. By the assistance of Doc Isguera and with the grace and provisions of the Lord Almighty. Thank you very much.
What else can I say? Wala na. Nandun na po lahat. Obviously, you have watched, seeing that this patient once again speaks from her heart kung ano yung naranasan niya sa journey na ito. And we patient and I hope that through this video testimonial, you would be encouraged to come forward, huwag kayong matakot, and sabi nga ngayon, buy your chance into surviving cancer kasi curable naman kasi siya. The patient's case would be followed up through the coming years. Hindi naman ibig sabihin, tumigil na. The care continues, all the nutraceuticals, lahat yan, tuloy yan. So, wala po tayong ititigil pa dyan dahil kasi nga it is important ngayon na ma-maintain na talaga, ma-maintain and ma-keep na yung kanya ngayon. So, if you have questions, if you have suggestions, if you have anything you want to bring across towards me, you can write it down dyan sa baba. Makita niyo po yan, may link dyan. And I would find time to answer each question so that you may feel. And I also invite you to come and visit my FB page, Dr. Lunas. Makita niyo yung mga kaso po ni Ma'am, nandun na rin yun, na-posted na rin yun doon, and all other patients. So, once again, Eva, thank you so much for your time. It's a Sunday.
Pleasure, Doctor.
Oo, it's a Sunday, family day, but sabi ko nga, nandito siya to give us the favor of creating this video para sa inyo. So, salamat po sa inyo, and I will see you on the next video. Stay blessed. Salamat. Bye-bye.